Hi, my name is Jennifer Sweeney. Welcome to our Bite-Size Learning Series. This is Patient and Family Engagement, Module 1. We're going to cover a lot of ground today, and most importantly, I'm going to help you understand how patient and family engagement can not only support, but accelerate your performance under the Quality Payment Program. Also, make sure you watch until the end of this short video because I'm going to suggest ways you can lock in what you've learned and quickly implement some PFE action steps to get you closer to your practice's goals. Back in 2013, my colleague Christine Bechtel and I worked with a group of researchers to identify the best practices in the field when it came to patient and family engagement. We synthesized those findings into the definition that you see here on your screen. This definition is really different than the way in which we have typically thought of patient and family engagement. It uses words like active partnership, and it really is rooted in collaboration and co-design. And I think it's really important to note that the reason why this definition is framed in the way that it is because it reflects the learnings that have emerged in the field over the last 10 years. Learnings that tell us that partnering with patients and families works. This updated concept of patient and family engagement, in which co-creation and collaboration are central, is an important evolution because the cold hard truth is that old school patient and family engagement strategies didn't work. They were paternalistic. We used words like compliance and said things like, we're going to allow patients to review their care plan. What has emerged in recent years is a body of evidence that sets the stage for a new, more meaningful kind of engagement. This new approach to patient and family engagement isn't about telling patients what to do or getting them to be better patients. We've tried that and it doesn't work. Many education campaigns don't work either. If they did, nobody would have diabetes. Smoking would be completely eradicated and everybody would exercise an hour a day. We need to stop trying to get patients to do what we want them to do and instead focus on patient and family engagement strategies that really work. So let's look at what it means to partner with patients and families from an operational standpoint. When I talk about patient and family engagement, I'm talking about partnering with patients and families at two levels. The first is in direct care, which means partnering with patients and families in the exam room and at the bedside. The second is in system design and governance, and that means working in partnership with patients and families inside your practice to help you improve or to redesign your practice or transform it. So let's drill down a bit to talk about direct care and what that means. It means working with patients to build their capacity to get and stay well. In terms of what that looks like, it's things like shared decision-making, patient activation, collaborative care planning. And it's important to note that these strategies are all grounded in partnership. They're not a one-way education process. Instead, they're really bidirectional. So you're learning from patients and patients are learning from you. And this is really about that co-collaboration and co-design that I talked about earlier. So the second level of patient and family engagement is working with patients and family caregivers to help you enhance your practice. And this is really the newest dimension of engagement. And from my perspective and from the work that I've done in the field, there are lots of opportunities to tap into the unique perspectives and experiences of patients and families. And I think this approach really makes a lot of sense. So why continue to do the same old patient and family engagement when we've seen that oftentimes it doesn't work? Instead, when you do things like patient surveys or when you involve a couple of patients in one of your quality improvement projects, you get a fresh set of eyes and an extra set of hands to help you meet your quality metrics or lower your practice's costs or improve your patient experience scores. The idea here is that if you redesign your practice for your patients, it may or may not work because you're still going to be guessing at what works for them. But if you design or enhance your practice and your care delivery processes with patients, there's no guesswork. They will help you do it and they will help you do it well. So why should patient and family engagement, and in particular this new kind of patient and family engagement, be on your radar screen? Well, the literature and the evidence is clear. When you partner with patients and families, when you collaborate with them, and when you co-design the system to better meet their needs, you get lower costs, you get better outcomes, better patient experience, and I think just as importantly, better satisfaction, both for clinicians and for staff as well. Patient and family engagement is also fundamental to the quality payment program. For example, 60% of your MIP score comes from quality measures, and one of those measures is patient experience. Others are things like medication management, functional status, and advanced care planning, which all require that you engage effectively with patients and family caregivers. Another 25% of your MIP score is focused on EHRs that include a patient portal and patient education. Again, those rely on effective patient and family engagement as well, because as you know, portals can be a great thing, but not if patients don't use them. And then the final 15% of your score comes from improvement activities, things like putting patients on quality improvement teams, creating an advisory council, or involving patients in other ways that bring their voices to your improvement efforts. The bottom line here is that working in partnership with patients will not only accelerate the changes in your practice, but from my experience in the field, working in partnership with patients and families sustains those changes over time because they will help you understand how to create your processes and your care delivery systems in ways that truly meet the needs of patients and families. That wraps up this first bite-sized learning module. Now that you have a sense of the two levels of patient and family engagement, please reach out to my colleague Christine or I at any time to talk about tailored strategies for your practice. And definitely tune in to our next module where Christine will dive more deeply into the various patient and family engagement pathways, so when to use them and for what purpose. Also, don't forget to lock in your learnings with some activities you can find on our landing page. Thank you.